Now, the Target 12 investigator is tracking the latest on Rhode Island's coronavirus surge. We're joined now by Target 12 investigator Ted Nesi, who is part of the team that's been tracking the COVID data since the very start of the pandemic. And Ted, as we mentioned earlier in the show, Rhode Island has set a new one-day record for cases.
Yeah, Kim, Brian, it's really striking to see these numbers when you think back to how low the case counts got last summer. Let's go right to the numbers from our interactive data page on WPRI.com. First off, we've actually had to resize this whole chart to fit the new record on here. Over there on the right-hand side of the screen, you see over 2,300 new cases reported yesterday. As you said, Kim, by far the most in a single day since the pandemic began. And I also want to show you a year-over-year comparison of daily cases. The blue line here is last year, the yellow line is the same day this year, and you can see we're now far above in Rhode Island the case counts of a year ago at this time, and far above the average at any previous point in the pandemic. We don't have granular data on the genomic sequencing of these, but experts seem to think it's a mix of Delta cases now that cold weather is here and we're inside more, along with, of course, the contagious new variant.
Striking to see the numbers, and certainly that you had to change the aspects of the chart to show the new number. Of course, one of the big things a lot of folks are talking about is what is the strain on our already strained hospital system. You chatted with some folks today about that.
Yeah, this is something we've been hearing about a lot because the hospitalization data does tell you how things have changed from a year ago now that many people are vaccinated. Here's the chart of total COVID patients hospitalized by day since the beginning of the pandemic. You can see, unlike with cases, Rhode Island is still a good ways below the peak of almost 500 patients hospitalized last winter. Right now that's around 300 patients. Another way to look at that data is here. Again, blue line is last year, yellow is this year on the same day. Almost a third fewer COVID patients in the hospital right now.
But Ted, I know hospital leaders that we've spoken to have been stressing that due to staffing shortages, they're struggling to handle this many COVID patients along with people who have the flu and other problems, even if, as we just saw, it's far lower than last year.
Yeah, Kim, today I interviewed Dr. Megan Ranney, emergency medicine professor at Brown, for this week's edition of Newsmakers. Anita Buffoni shared some of that interview earlier, but here's what Dr. Ranney had to say when I asked her about the situation locally inside the ER departments.
Can you just sort of talk us through how December has looked? And now we're taping this Tuesday morning between Christmas and New Year's, but what it looks like inside emergency departments right now in Rhode Island?
I have never seen it so bad as it is right now. We have been short-staffed for months, and I want to be clear, it's not because of the vaccine mandates. The hospital systems in Rhode Island kept workers. It's really because people are burnt out and tired, and because some of our nurses and other staff can make more money going to other states.
What a message there from one of Rhode Island's most prominent emergency room doctors, Megan Ranney there. Incredible there. Target 12 investigator Ted Nesi, thanks for joining us at 4.
Brian, good to be here.